Okay, hello and welcome to our presentation on tuberculosis. My name is Vanessa and I will be presenting with my partners Kyle and Luke. Next. Okay, so what is tuberculosis or TB? TB is caused by the bacteria Mycobacterium tuberculosis, and that spreads from person to person through microscopic droplets released into the air from coughing or sneezing. This also affects the lungs, but can also affect other parts of the body, such as your kidney, spine, and the brain. And not everyone infected with TB becomes sick. So you could have latent TB or active TB, which we'll discuss a little bit further into the presentation. Next. Community objectives. So we need to identify at-risk individuals. These are individuals with weak immune systems, and we need to recognize the signs and symptoms and screen if you are showing these signs and symptoms. Also, ensuring proper cough etiquette, which means sneezing or coughing into a tissue or the inner of your elbow, and refraining from using your hands. And using proper PPE. So if you do test positive for TB, you want to make sure you're wearing a mask and refraining from being out in the public. And understanding that if you do test positive for TB, you will be required to follow a strict medication regimen, even if you feel better, and making sure you finish all the medication. And also screening individuals that come from different countries that have high cases of TB. Next. So per the CDC website, 23.7% of TB cases are in California, with 3% of that being within our homeless community. So why is our homeless community affected? Well, that's because, they're living in close quarters and they lack shelter from the environment, such as the rain and the cold. And they also lack proper medical care. They will not go to the hospital if they are presenting these types of symptoms. Next.
So let's go ahead and cover our risk factors, our preventative measures, and the signs and symptoms. So what are our risk factors? So people who have autoimmune disorders such as HIV, AIDS is a big one. Other disease processes such as diabetes, kidney disease. You have chemo patients, and then people on organ transplant drugs that are usually immune suppressant. Next, you're going to have your signs and symptoms. You're typically going to see weakness, fatigue, weight loss, no appetite, fever, chills, night sweats, and coughing up frank blood. I'm going to go ahead and cover some of the preventative measures, which we can do is health screening, public educating, we can quarantine when the infection is detected, and understanding latency. So I'll give you a quick description of latency. So TB bacteria can live in the body without making you sick. This is called latent TB infection. And most people who breathe in TB bacteria and become infected, the body is able to fight the bacteria to stop them from growing. Other things we can do is to have proper hygiene, good ventilation, and prevent the development of drug resistance during therapy. So keep on that regimen. Next. So now that we've covered the prevalence, the risk factors, the signs and symptoms, we can go ahead and start to see or cover who should be screened. Anybody who has spent time with somebody who has TB needs to be screened. People from countries where TB is common. Anybody who works with or lives in a high-risk setting such as correctional facilities, nursing homes, homeless shelters, that would include healthcare workers, incarcerated individuals, and substance abuse patients. Next. So what resources do we have within the community? Well, you have a physical address for the San Joaquin County Public Health Services. You can contact them to set up appointments between 8 and 5 p.m. You will be contacting the 468-3828 number, and they can be visited at 1601 East Hazelton Avenue here in Stockton, California, 95205. Next.
Okay, Let's talk a little bit about treatment of TB. Once an individual is diagnosed with TB, there is a bunch of medications that they need to take to end up killing the bacteria. And if they don't adhere strictly to this medication regimen, it's likely that the bacterium will go latent again and only pop up again sometime later in that patient's life. So what the preferred regimen is an intensive 2-month phase where you take 4 pretty hard-hitting drugs all at once. These drugs are isoniazid, rifapentine, prozanamide, and ethambutol. And after you're done with that 2-month period, the initial 2-month period where you're taking all those drugs each day, you continue on with another 4-month period of isoniazid and rifapentine. Now, sometimes if the clinician that's diagnosed you with tuberculosis doesn't think that you will adhere to this regimen, they will prescribe a DOT prescription for the treatment, which is direct observation of therapy, which means that that patient will then have to present to the clinic each day and take this medication in front of a healthcare professional. And that's one of the ways that we can eliminate TB in our communities is by adhering to this strict regimen. Next, benefits to the community. The benefits to the community are huge. These resources that are made available to us will help us decrease the prevalence of tuberculosis in our community, which is great because that will slow the spread, and hopefully we won't get sick with TB. They also provide the medication and advice to those diagnosed with tuberculosis. They screen high-risk individuals to make sure that those individuals know they can follow up with them and make sure that they don't have TB. And they also do contact investigations. For those that have been diagnosed with tuberculosis, they'll do an investigation on who you've been spending close time with, and they'll contact those individuals and make sure that they understand the risk that they have and to seek treatment for that, or at least screening. Next. So what we've learned through this practice, or what we've learned through this exercise and how we're going to apply that to our nursing practice is when we when we care for our patients, we're going to recognize the signs and symptoms of tuberculosis. If we have a patient that reports night sweats, unexplained weight loss, persistent cough, we're going to recognize that, and we're going to suggest screening to them, or performing that screening ourselves. So we'd be able to identify who's at risk, and we've learned what community resources are available to us, and we can share that information with those people that we've diagnosed or suspected are at risk of TB. We were asked to speak a little bit about the Healthy People of 2020 goals. This is a government program aimed at reducing the mortality of those living in the United States. And they have a bunch of literature that's available to communities that want to take place in these programs. The kind of literature that they have available is remind systems to increase patient adherence to medications, diagnostic and treatment information for multi-drug resistant tuberculosis, and fixed dose combination of drugs for treatment of pulmonary tuberculosis. And again, all this literature can be found at the Healthy People of 2020 website. And here at the back end, we have listed some resources and where we found this stuff online. That's our presentation. Thank you very much for listening.